Given it a few minutes, I think we can go ahead and get started. Welcome everyone to this afternoon's webinar about balance for caregivers. My name is Lisa and I work for Steadii. I will be moderating our discussion this afternoon, but our guest of honor here is Geriatrician Dr. Sally Brooks. Dr. Brooks has extensive experience, not only in clinical practice, working in acute and post-acute and outpatient care, behavioral health, and so much more. She also has more than 30 years of experience in healthcare academia, coaching, mentoring, and helping companies develop and implement innovative and high-quality programs that are very much focused around caring for people. So that is why we brought her in today. She has all of this wisdom to share with us, and I'm very excited to introduce her. Welcome, Dr. Brooks, and thank you for joining us today.
Thank you, Lisa. And I want to welcome all the caregivers out there, people who care about the caregivers, employers who employ caregivers. It's a very important topic, and I'm really happy to be here.
Great, thanks. Well, to kick off our conversation, do you mind telling us just a little bit more about yourself and your professional background and why supporting care partners is so important to you?
I sure will. I started out my career as a pharmacist, and when I was in training in the summers, I would do home visits to older adults. And it was there that I saw a lot of the gaps in care for older adults, a lot of isolation, what I would call successfully aging, did not occur in many of these homes. I had a contrast with my grandmother, who got out of the house, was able to work and have the means. And so that drew me to geriatrics to try to help decrease the gaps in care for older adults.
Yeah, that's wonderful. And I cheated a little bit because I know you personally, and I know you have extensive experience as a familial caregiver yourself, caring for your parents and maybe some others. Can you give us a little background on that?
Sure. Well, my caregiving experience started when I was around age 28. My mother battled depression her whole life. And so I was sort of in medical school at the time, and you naturally become the caregiver when you're the one in medicine in the family. And so I really have been a caregiver since age 28, really trying to prevent mom's depression and be on the front line and helping her get depression treatment. Around the same time, my grandmother became ill. And so I was caregiving really for both of them from afar. And about 10 years later, my dad developed dementia of the Alzheimer's type.
Mm.
So and I guess, right in the middle of all that was, I had twins and then another child and was caregiving for children.
That's a lot. When, when you talk about balance, you're already juggling and balancing so many people you're caring for, much less balancing things in your own personal life. We're going to get into that a little bit later, but to kind of set the stage for that, based on your experience, what do you think the mental and physical impact on care partners typically is?
Well, I think mentally, there's can be a lot of isolation. I think you can feel guilty. Are you doing enough? You can feel guilty because you might have some resentment for your care partner. I think medically, I saw this over and over in my practice where the caregiver was neglecting their own health,
Mm.
and therefore many of them were ill and then had to leave the caregiver chain suddenly. So I think there's a dramatic impact on both caregivers' mental, emotional, and physical health.
Yeah. We see that a lot in Steadii. I can share my screen here really quick and show a couple of stats that we have um, because it is quite profound. Potentially, I can share it. Yeah, just the stat that an estimated 71 million Americans will be a caregiver and experience far higher rates of physical and mental health deterioration and even earlier mortality than their non-caregivers. We see this increase in depression, suicide, all of those things that you just mentioned. Knowing all of that, what resources are out there that are available to caregivers?
Yes. Well, I think the reason I'm very interested in the Steadii project is that a lot of the resources out there are to instruct caregivers on how to take care of their loved one. So there's the Alzheimer's Association, the Parkinson's Foundation, and it's really geared towards, hey, caregiver, this is how you better take care of your care partner. As
Mhm.
opposed to, we're really worried about you,
Yeah.
as the caregiver. And I know as a personal caregiver, I felt like um, I could have used some support, certainly emotionally and physically. So that's what really draws me to this program. It's really about the caregiver and focusing on them. I
Mhm.
would love to see payers, health insurance, Medicare, really focus more on the
Mhm.
caregiver because they're such an important and vital link to keeping the loved one in their home.
Yeah. And we're going to get into study a little bit more down the road, but before we get there quite yet, in a typical medical practice and kind of a traditional setting, what are some of the support resources that a care partner can expect from their medical providers, or what should they be asking for?
Right. Well, typically, a busy office practice, whether it's a primary care physician or a specialist, doesn't really have the resources to focus on the caregiver themselves. They will provide them information, pamphlets for the Alzheimer's Association, the Lung Foundation, or here's where you need to go get your particular laboratory test or your radiologic image. But they don't really have resources to focus on the caregiver. And that's a big gap that I see. There are practices, like I had a geriatric practice, and I was afforded the ability to have my own social worker and nurse to really help with some of that care management. But typically, in a normal PCP or specialty care office, they really can't offer that much. They don't have the capacity or the capability.
Mhm. Yeah. Um, it's interesting. I was just talking to a caregiver recently who kind of gave this example of she had one parent who was diagnosed with cancer and one parent who was diagnosed with dementia. And she said, talking to her healthcare providers about the parent with cancer, they had a whole plan set in place. And it was very clear these are the steps that are going to happen, these are the resources available. But on the dementia and Alzheimer's side, it was just here's a diagnosis, good luck, and out into the world. And she kind of reflected the same thing, that there are a lot of resource gaps. Let's jump into challenges in your geriatric practice. What do you notice are some of the biggest challenges that care partners face that might highlight some of those gaps as well?
Right. I think one of the biggest things is just amount of help.
Mm,
And part of this is the care partner or the caregiver themselves, and that sometimes they have the feeling, well, I can do it better than anybody else.
mhm,
Another feeling can be, I'm a little embarrassed to have somebody in my house, or I
mm,
don't like the lack of privacy of having somebody in my house. I think one of the challenges is getting enough help. Um, One of the things that we need to help caregivers with is asking for help.
mm,
People want to help, they just don't know what to do. And so, very specifically, say, boy, I could really use you to come in for 30 minutes so I can, you know, tidy up the house a bit. Or I could use you for 2 hours so I can get out and go to the grocery. Maybe if you get real specific, you can even get more help, which is, I really need somebody to come over here and throw my laundry in,
yeah,
or I could really use a meal. So I think part of it is just asking for help.
for
I
sure.
think people really do want to help. I think the other challenges are just sort of the overwhelming 24/7, 365 aspect of caregiving and not getting sleep, feeling fatigued. So I just think there are so many challenges for caregivers that we really need to think about resources for them.
Sure. In your experience, if you had a caregiver in front of you who would say, yeah, everybody tells me to ask for help. Everybody tells me they want to help, but this is my loved one. I know the routine. I know all of these things. I might have fear or embarrassment or guilt. kind of putting that off on somebody else, how would you encourage them to start that conversation?
Yes, I think what I would tell them is you need to take this little box off the shelf, which has you in it.
Mm,
And you need to say, what is in there that I need? Self-care, just getting out and taking a walk, having the time to um, just reflect, read a book. You really need to take yourself out of the box and off the shelf. And
mhm.
sometimes you need to put your loved one in the box and hand it to somebody else. So it's a bit of a visual, but it's a lot of times best just to start small and see how that goes. I think a lot of persons are worried that the loved one at home, because of their illness, it could be heart failure, it could be lung disease, that could be scary for somebody else. And so I think it's just over time, small increments, growing that affiliation or relationship.
Sure. One thing we talk a lot about Steadii, especially when we run into caregivers who are feeling that guilt for taking me time, or this phrase self-care gets tossed around a lot. And some people will roll their eyes and say, nah, well, wouldn't that be nice if I had time for self-care? But the reality is that if you are caring for yourself better, you're going to be able to endure this journey a lot longer. Have you noticed examples in yourself, your loved ones, or patients and their caregivers where people were able to sustain themselves and be better caregivers because they were good at taking time for themselves and taking
Right.
themselves out of that box?
And the realism here, they may not have a lot of time. So
Yeah.
in the time that they feel that they can take, really learning practices that are fairly easy. So set your alarm a little before
Mhm.
you think your care partner is going to get up, and if you can predict that,
Sure.
um, and take some time for yourself. I every morning like to do a really brief meditating practice, which is, if you don't mind, I'll share it with you.
Do.
Sort of lay there on my back in bed, and I imagine a very bright white light coming, from the heavens down and sort of hitting me right here in the head. And
Mhm.
then I imagine it traveling through my heart, my body, and then still having enough energy to take that light energy and go up to the sky.
Mm.
And you do that with some deep breathing, deep inhales, deep exhales. But really, what makes it beneficial is sort of three affirming words. And
Mm.
these words can change over time. So, for a particular day, maybe you have to get your loved one to the doctor and you're going to feel overwhelmed. Just to say, no, coming from down the sky, I'm ready. Maybe what you need, word traveling through your body, I'm strong. And maybe the word from your toes to the heaven is I'm fearless. Other
Mm.
days you can say, I'm worthy. I'm worthy of being cared for. Um, I'm loving, any of that. And what's interesting, it takes about 3 minutes
Yeah.
and it just can really calm you down. The other thing I like to do is just get up and stretch and move. That's very
Yeah.
helpful. And if you can do so safely, just walk outside or just breathe some fresh air. So a lot of these practices don't have to take a lot of time. And I just think it's really important. I think more engaging self-care, maybe you're going to get out to an exercise class or go walk with a friend. What I find you have to do is you actually have to schedule it. And then you
Mm.
need to keep that appointment with yourself.
Sure.
And if you're really good at it, you can create a contingency plan, right? So my friend Peggy's going to come over, but she also cares for her grandchild. Maybe I should also ask Gretchen as my backup plan.
Mhm.
So it really takes practice. This doesn't come naturally, but you'll find if you schedule, it makes things a lot easier. I think I shared with you, Lisa, that I traveled at one point. A lot for business. And so what I did is I had some dear friends, again, that were always willing to help. And I actually had a calendar schedule for the days that I was going to be gone. Um, they would sign up for a day and they would go spend an hour with my mother, nursing center at the time. And I said, I'll pay you back, but just take her something that she likes to eat that she's not going to get in the nursing center. So
Sure.
my mom got a lot of frosties, uh, peanut butter milkshakes. But it makes that person who helps you feel good too. And then I
Yeah.
didn't have to worry. I thought somebody I know and trust is laying eyes on my mom once a day while I'm gone. And at one point, I also paid somebody. It was a daughter of a friend who was a nursing student. And so
Mm,
she made a little bit of money and she got some skills and it was really helpful to me.
excellent. Yeah, you bring up a couple of good points there, but I want to hone in. So, we talk about balance for family caregivers who might have their loved one at home, but they also might be living separately for their loved one. Their loved one might be in a nursing facility or an assisted living, something like that. What would you tell caregivers who maybe aren't living with their loved one that would encourage them to seek these practices and find balance in their life?
Right. It's really hard living out of town or far away from
Yeah.
somebody that you're providing care for. And that was the case in my life. For the first several years, my parents lived 2 hours away. It really did get to the point where I was sacrificing time with my toddlers
Mm,
to be with my parents. And so that's when I had to become sort of the mother of the family over my parents too, which can be very hard to take the maternal, or if you're a man, paternal oversight of your parents. But it came down to a conversation that I said, you realize that I'm probably going to be the one that's always going to take care of you, right? And for me to be able to do that, I'm going to need you to be closer to me. And that can be really tough, but you do have to figure out ways to make it fit in your life somehow. Now, as far as the nursing home or assisted living, I was in that situation as well, and a lot of people are. I think many people choose to move to assisted living or maybe an independent living on a campus, thinking I'm
mhm.
preparing for when I need more help. The reality is, in the nursing center, they don't have, um, the need to have to travel somewhere else, go to somebody's house, and so there's people there that are going to be able to interact with you. But in assisted living or independent living, those care partners are still having to do a lot of the heavy lifting themselves. And so, many of the assisted living and independent living will contract with home health. They don't even run the home health themselves. And so you're going to be out there getting some resources on your own as well. But it's very hard. It's very different. But it doesn't mean that just because they're not in your home, your caregiving responsibility is alleviated.
Sure. Makes a lot of sense. What would you most want your patients' care partners to learn? If you had them in front of you and you could tell them, here's maybe two or three little nuggets of information I really want you to take away in your caregiving journey, what would those things be?
Well, I had a friend and mentor who talked about the word care as an acronym.
Okay.
And so when you think about taking care of somebody, you want to be compassionate. You
Mm,
want to be aware of their needs. You want to have realistic expectations. And I think those are some of the things that can be a barrier for caregivers, especially I find spouses. Sometimes the spouse feels like, okay, they really could do this for themselves.
sure.
They have done it in the past, and maybe that's not a realistic expectation. But I want to turn that 180 degrees and focus on the caregiver themselves. They need to have compassionate awareness for
Mm,
themselves. This is all I'm going to be able to manage today. Or it looks like it's going to be a day where I'm never going to get out of my pajamas.
sure.
Take care of this other person and realistic expectations of yourself.
Mhm.
I'm not going to have a tidy house every day. And so I think the care acronym works for both. So I think I would bring that awareness to a caregiver, but I
Mhm.
do think the number one thing I would tell them is, you know, um, power comes in education, making sure you're educating yourself. And so, really trying to give them sort of those bite sized pieces of information. Giving somebody a link to go research is not what a caregiver needs. They need something handed to them kindly, that they can sort of read in an efficient way or learn from in an efficient way. So I encourage them to get education. Again, seek help. Doesn't always have to cost you money. A lot of times if you're in a faith-based organization or just your community and neighbors, I think you can find some help for yourself. So I think those
Mhm.
would be the number one things that I've taught my families.
Yeah, that's excellent. As you were talking, I was recalling one of the study practices that we use for our caregivers. Um, and I think it especially works for caregivers who might have difficulty asking for help, making that phone call and saying, hey, I need a meal. Hey, can you come sit with mom? Can you come do whatever? And the practice is simply to write an exhaustive list of the resources you have. So maybe it is your church, maybe it is your neighbors, maybe it is the Alzheimer's organization and their resource page. It can be, it doesn't have to be a person, it can be anything that is in your orbit that could be helpful. And you will get down to individual names, right? Your siblings, your neighbors, that kind of thing. And you just make the list. You don't have to ask them anything. But then when things get overwhelming, challenge yourself to look at that list and remind yourself that you are a resource, and just pick one or two, or if you're feeling really brave, three, and reach out to those three resources with your ask and see what happens. You know, a lot of times I think people think that the consequences for asking for help might be negative, but it almost always turns out positive, right? Like you said, people want to
Yeah.
help.
Yeah. I think it's positive for you if you're helping someone. But it really does help the caregiver realize that they're not alone. I think the loneliness and isolation of caregiving, even if you're remote from your family, you know, really nobody really knows how you feel.
Right.
They can empathize if they've been through this. Um, so just anything that you can do to combat the loneliness.
Yeah.
One of the things that I tell families and really patients themselves is to surround your things with self with things you love that are
Yeah.
close. And so whether that's books, whether that's, hey, there really are some things I like to watch on television and it's there and it's close.
Yeah.
I know a lot of older adults have at least one window, whether they're in a nursing center, in a home. Um, I say get a bird feeder, feed the birds.
Yeah.
It's very relaxing. I love to watch the birds. Sometimes it's a fish tank. Just surround yourself with things that you love and things you love to see. It doesn't cost much and it helps you sort of focus on positive.
Yeah. I love that. You've shared a lot of really good nuggets about making time for yourself. It sounds like for you that was maybe in the morning, and even 10 or 15 minutes can make a huge difference in your day. I think when we talked before, you mentioned just like having a new child, you sleep when they sleep, maybe to
Yeah,
capitalize on that.
absolutely. You
Mm-hmm.
know how like when you have a baby and everybody wants to come see the baby and they want to hold the baby. I'm pretty direct person, as a lot of folks here on this program know. I'd say, well, I'd love for you to hold the baby, but would you mind throwing a couple of loads of laundry in first? You
Yeah.
know, and
Yeah.
then you sort of get what you want and they get to visit with you and visit with the baby. But absolutely, when your baby naps, you take a nap. And
Yeah.
so that's what I would tell my caregivers as well.
Yes.
When you lay down to rest. If you're not going to sleep, what do you love to do? Do you want to read a
Yeah.
book? So that's very important.
And having compassion for yourself. If you need to do laundry or need to vacuum, but you have a window where you can sit and zone out and watch your favorite show or read your book or drink a cup of tea, whatever it is that makes you happy, that might be more energizing, and you'll get to the vacuuming. You'll get to
Right.
the laundry. Being direct.
I know one feeling that I had, and I know my familial caregivers had it too. If it comes down to something that's tough, and a lot of one of the care transitions we think about is if you need to get more help in a building away from your home, whether that's a
Yeah.
nursing center, assisted living, you really do feel like you're damned if you do and you're damned if you don't.
Mm, yeah.
And you're never going to feel completely great about either decision. They can be home with you and you can be very frustrated and you can
Sure.
be angry. And later in the day, you're going to feel guilty about that. And
Yeah.
then if they go to a place where you get more care to take care of them, let's say a nursing center, you're going to feel like, well, oh, I'm not there. Who's making sure that, their shoes get tied in that special way? And so what I always said is, look, these people get paid.
Yeah.
Um, they get paid hourly. This is their paid job. And your job now will be to, also be an advocate, but also to give them that tender, loving care that they really don't have the experience or the knowledge of your loved one to give. And
Hmm.
so I think that's one of the things that I always felt like some of your choices are not clear and any of the choices aren't 100% great. So I think that's a feeling that I often have.
Yeah. And that's where that compassion comes in too, and just trusting your own intuition and knowing that you are the person that knows your loved one best, knows what they need, and you're going to do everything that you can, but you also have to keep yourself healthy. And it's,
Right.
I mean,
Right.
not to bring the title of this back in, but it's a balance,
Right.
not to
Right.
be too cheesy.
Right.
No, I think that's good. I think those are some really good practices that you've kind of given us to think about. We are going to talk about Steadii for a second, which is a free resource to anybody who's joining this webinar today. But I do want to let people know if you have questions for Dr. Brooks, go ahead and start dropping them in the chat if you haven't already. And we'll spend this last 10-15 minutes kind of answering any questions that you might have for her. Our next webinar, if you haven't signed up, is in a couple of weeks on October 30th, I believe. And that's going to be a lot about boundaries. I know a lot of caregivers run into boundaries for themselves, boundaries with their loved one who they're caring for, but also family dynamics can get a little wacky, right? You get a lot of opinions coming in when you're all caring for someone that you love. So we're going to be addressing that in the next webinar. But go ahead and start dropping those questions in the chat. And in the meantime, I'm going to pull up a screen and tell you all about a very free opportunity that we have with Steadii. I'm struggling to get my screens right here. So bear with me for just a second. Okay. Dr. Brooks, can you see my screen okay?
I can see you've started sharing your screen, but I don't see anything on there yet.
Do we see Steadii now?
There you go.
Perfect. So if you are new to Steadii, Steadii is a caregiver support platform. Dr. Brooks did a good job of kind of summarizing this before, but so many resources out there really focus on teaching you or telling you how you should be caring for your loved one, which is so important. But Steadii came around to fill the gap of caring for you so that you can be sustained and have the endurance that it takes to care for a loved one without experiencing the physical, mental, and emotional deterioration that so many caregivers do. The way that we do this is really, it's a digital platform. It is all virtual, but our secret sauce, if you will, is our advocates. We pair every care partner, caregiver with an advocate who is there for you when you need them. You meet with them virtually over Zoom calls. You can direct message them with questions that you have. But their job is really to get to know you on a very personal level. They get to know your situation. You know, so many caregivers seek advice or validation, or they just want to talk about their unique caregiving situation, but there aren't a lot of people who really get it and understand what they're going through. And your advocate is assigned to you to really dig in and understand what's going on in your life. All of our advocates also have mental health backgrounds of some sort. They're either therapists themselves, or they're social workers, or they've been in nursing care, and every single one of them has experience caring for a loved one themselves. Many of them, their parents, and that kind of thing. So they're really there to act as a sounding board, hear what it is that's going on in your life, and be able to give you practices like Dr. Brooks did today, the meditation in the morning, encourage you to set boundaries, give you different bite-sized practices that are really practical and fit into your life, because we all know that caregiving is a very busy job. You're already overwhelmed and you don't need new things in your schedule. So this is really designed to kind of fit in your schedule there. So that is Steadii. We have limited capacity for our free users. If you want to go ahead and scan this QR code, it will take you to a sign up page where you can get on the wait list, because in about a week, we will be opening that up and have lots more space for people to match with advocates and take advantage of this free service. Um, we do have some questions rolling in, Dr. Brooks. Um, let's see. How can caregivers approach balancing their own health needs with those of the person they are caring for? Great question.
Yeah, that's a really good question. You hear stories, and I had some in my own practice where the person neglected their own health. They attempted to move somebody, and they shouldn't have done it in that way, and or they were too weak, or they were just mismatched in body size, and something bad happened to them. I had a caregiver who also ignored chest pain symptoms and passed before their loved ones. So I think part of it is we talked about compassionate awareness. Our
Mhm.
caregivers really need to take a little time and think about, what is my body telling me today?
Mhm.
And that's hard to do when you're super busy. But I think that's one of the important things. All of those important preventive things that we do, vaccination, if you're a woman, a yearly female exam, a mammogram if you're of that age, men getting their annual exam. That's one of those things that is considered self-care. And you just need to schedule it and get it on the calendar. And again, you just ask somebody, can you sit with them? You might need somebody else to be taking you to and from your appointment. And it like you said, Lisa, sometimes it's hard to think about who those people would be. Like, oh, well, that person works. And you start talking yourself out of it, right?
Yeah. Yeah.
You might call that person who says, oh gosh, I wish I could. I'm traveling for business this day, but how about so and so? Like,
Yeah.
let's call so and so. So it's really important. I think the other thing that I neglected in myself, and I saw a lot of my familial caregivers neglect, is just how they're feeling
Mm.
and, rest. Um, so I think it just comes back to you've got to do those essential things for yourself. Don't let it go. Don't let it slide. Um, and again, I think just scheduling it in is the thing you
Yeah.
have to do, put it on a calendar.
Yeah. This might be a really detailed question, but I'm sitting here. I know you mentioned that you had a calendar when you were caring for your parents, that other people had access to. Did you just keep a paper calendar and keep it posted somewhere, or was there a tool that you used?
Yeah, I mean, I think it depends on how sort of technologically
Sure.
inclined your caregiver circle is. But I know in my mom's room, I just printed off a monthly calendar, and I had the name and the phone number next to the person who was coming that day. And then, I would have communication, email tables with those people that were the caregivers, and they would sign up. It was
Yeah.
great.
That's
Um, so again, I can't say enough that you have to realize that you are the link in the chain. You're the important link in the chain. And if something happens to you, the whole thing's going to fall apart. So you have to figure out how to fit that into your day. I think the other thing I was going to say, Lisa, is, join a community. I
mm,
know in Steadii here we have a community if you choose to be part of it, and you can talk about something that happened and, hey, does anybody have any solutions? I was just thinking about, I had lunch with a friend about a month ago, and she cared for her older adult father with Parkinsonism, and she was dedicated to keep him
mm,
at home. And she's a teeny tiny little thing. And it wasn't that he was heavy or overweight, but when you get to have Parkinson's, you get to be a little bit of what we would call dead weight, like you really can't help. And she wanted to bathe him other than just sort of a sponge bath. She got a kiddie pool and put it
wow.
in the living room and stuck a plastic chair on it
Hmm.
and figured out how to get all around his body with it being safe for him and safe for her. And I'm like, that's some ingenuity right there. I would never even have thought of that.
Sure.
And she goes, I had the heaters on, towels there. But now just imagine you're somebody who's caring for somebody with a mobility issue of whatever, to like learn that from somebody else. It's
Right.
like, that's awesome.
Yeah.
Just
Think
like,
of all the
and so
creative.
I used to learn things like that from my familial caregivers all the time.
Yeah.
So just think about what you can learn from others. Encouraging an older adult patient not to drive usually requires a lot of ingenuity and therapeutic fibbing, I like to say.
Yep.
The keys disappear, or you detach something other under the hood, or the best way to do it is just get rid of the vehicle, like get it out of
Yeah.
sight
Yeah.
is the best way to do it. So, um, everybody that's in this sort of this world of caregiving together, they've figured things out on their own. And
Yeah.
those are great people to tap into.
It's a huge resource to be able to tap into the collective experience of other
Right.
caregivers. And the reality is if you're not a caregiver right now, you probably will be someday to
That
some
is true.
extent. Everybody will be in this club to some extent.
Right.
Most
It's
people.
interesting though, also, I was employed. I had a
Mhm.
full-time job, which included travel. And what I'd really love for employers and payers to wake up to, that 30% of your employees are in a very stressful familial or your next door neighbor caregiving situation. 30%. So think about how that impacts productivity, absenteeism, employee retention. I just know what a more loyal, supportive employee I would be if I knew my employer were thinking about me and taking care of me, and
Sure.
providing support resources for that to happen. Um, I have a lot of dear friends that, they said, I'm going to quit my job
Yeah.
and I'm going to take care of my parent in the home. And, um, we as a friend circle found that person becoming more isolated and turning down, visits with us,
Mm.
because they weren't sort of the type to ask help. So you keep
Yeah.
trying to hint and get them to take help, so it can be a very daunting
Yeah.
kind of life.
I mean, we all hear the phrase work-life balance, right? And that's for anybody. It's hard enough to juggle a career of any kind with your personal life, and then you throw in the full-time job of caregiving. And it just tosses everything out the window. If anyone here is interested in learning about Steadii for your workplace, we also really want to have a conversation with you about that. We are on a little bit of a crusade to help employers
Mhm.
really be able to support their employees so that their employees can retain their independence, their career, they can feel supported, and so that they can keep, being on the trajectory that they want to be on within your company. So we do have Steadii for the workplace. We would love to have that conversation too. Also, if you're a caregiver and you want to put your employer in touch with us, we would take that as well. Got to spread the word somehow, right?
Yeah.
So well, thank you for the questions, everyone, and thank you for attending the webinar this afternoon. Dr. Brooks, do you want to wrap us up with any final thoughts or anything before we let people go their way?
Yeah. I think I just want to say that you're not alone.
Mm,
You're not alone. And there are resources. And, I love Lisa's idea about just put everybody down on paper.
yeah.
In my family, there was a divide and conquer.
Mm,
Somebody was the person that was the handyman, when they were still living in their apartment. Somebody was the person that took on finances. I'm going to handle the checkbook, divide and conquer. And many times, not to be throwing any, gender generalizations around, but typically is the female that ends up doing a lot more of the hands-on
sure.
caregiving. And so realize that that can be very physically straining and put you at risk. So you need to think about people that you could pull into more non-traditional roles for them,
Mhm.
to help in the caregiving process. But just know that you're not alone. Know that there's resources for you. It might sound easy for us to talk about it, but I have lived it for both, professionally for my familial caregivers and personally. And you do come out on the other side. And you really do look back and say, that was an honor and a privilege to be able
Mhm.
to take care of somebody like that. And you
Mm.
feel good. You feel good about yourself.
Excellent, excellent wisdom from somebody who has definitely been there. Um, Well, thank you everyone for attending. Like I said, if you want to go ahead and scan the screen, sign up for Steadii to get matched with an advocate. And as Dr. Brooks mentioned, you'll also be added to our caregiver community where you have access to other caregivers, share those creative ideas with one another, share resources, and really be in there with people who understand what you're going through and really get it. And then in a couple weeks, we will reconvene to talk more about boundaries. I have a feeling we'll be hearing more about how to give those little fibs to disconnect a car or do those things.
But we call it therapeutic fibbing.
Therapeutic fibbing. I
Yeah.
love it.
Yeah.
Great. Well, Dr. Brooks, thank you so much for your time. And I hope everyone has a wonderful evening.
And I look forward to being with you in a few weeks.
Thanks, Dr. Brooks. We'll talk to you soon.
Bye. Bye.
Bye-bye.